University of Toronto. As the Vice President of Workplace Health and Safety, oversees all aspects of workplace health and safety programming within the WSIB, with focus on being in the forefront of innovation and creating a culture of health and safety in Ontario. Before joining the Workplace Health and Safety Services, Rod spent 4 years as WSIB's Vice President of Human Resources. Under Rod's leadership, WSIB was awarded the Mental Health at Work Silver Level certification from Excellence Canada. Prior to joining the WSIB, Rod held leadership positions at Rogers Communication, Allstream, and AT&T Canada. Rod was recognized with the Morley Gunderson Prize by the University of Toronto in 2019. I introduce a colleague and good friend, Rod Cook.
Good morning, everyone. Just a quick word on Threads of Life. WSIB is a huge supporter. They play a really critical part of Ontario's occupational health and safety system. So I do encourage you to find that QR code. Well, it's great to be here with all of you today in a room full of dedicated people to health and safety, and we're all focused on creating safer workplaces, and I love that this summit is all about that. And, you know, I'm lucky enough that I have a job that I'm passionate about. It's truly great feeling to start each day knowing that myself and this amazing team that I work with from WSIB are here contributing to creating safer workplaces in Ontario. And it's an incredible feeling at the end of the day to leave and feel that you're part of something that has helped contribute to safety in the province. I think everyone here can relate to that in some way, and I'm looking forward to sharing our experience with you and learning from you as well. In the spirit of learning from others, I do want to give a shout out to a partner, an important partner of ours, Nokiwin Tribe, has traveled in for this summit today, and thank you to Yolanda and her team for being here as well. For those of you who are not familiar with the WSIB, our mission is to reduce the impact of workplace illnesses and injury for the people of Ontario. We provide short and long-term disability insurance, no-fault collective liability insurance, 100% funded by employers of Ontario. We support people who are injured, made ill on the job, and help them have a safe and timely return to work. We give them access to a network of thousands of healthcare providers across the province. We provide income replacements so people off work don't have to worry about essentials like their next meal, their mortgage payment or rent while they recover. We provide jobs and skills training if any injury prevents them from getting back to work. We can arrange home modifications, such as wheelchair ramps or door widening. And if the unthinkable happens and someone dies from their workplace injury or illness, we cover their funeral expenses and counseling services for their family, employers, and coworkers dealing with the grief and trauma that no one should ever experience. So what all of those services have in common is that they're essentially reactive. They're the pound of cure when something goes wrong. But it would be much better for nothing to go wrong in the first place, to have Threads of Life and WSIB not needed. That would be ideal. Like you, we know how powerful 1 ounce of prevention can be. And we know that most businesses would do what it takes to prevent injuries and illnesses. They know it's the right thing to do, but they may not know how to do it. They may not know either that health and safety is good for their bottom line. We've heard a few speakers talk about the economics of occupational health and safety. Every year, I and the WSIB's Workplace Health and Safety Services team speak with hundreds of businesses on why health and safety is important and how it benefits everyone. We tell them the benefits of a health and safety workplace are pretty straightforward. People can focus better at work if they know they're safe at work. And that leads to better quality and higher productivity. We like to think of it as the safe and sound principle. Safe workplaces make for sound businesses. That can be especially useful in economic uncertainty like we're living in today. Because the less a business has to worry about the shop floor, the more it can focus on its products and services. And I have to say, it's a great feeling when we see those employers connect those dots. It's an even better feeling when we share how we can help them by giving them access to the knowledge and resources that they need to be a successful business. Our health and safety programs can help them build robust health and safety systems and save money right from the word go. For example, we give any business registered with the WSIB free access to the Canadian Centre for Occupational Health and Safety's Business Safety Portal. That value is about $1,700 annually. Our online services are where businesses can also see their detailed claim data and analyze their health and safety outcomes to have an improved focus on where they need to pay attention, and they can also see how they compare to their competitors who are investing in health and safety. This online transparency gives businesses incentive to improve their workplace health and safety performance even further. We also have our Health and Safety Excellence Program, which connects businesses with great providers like 4S to work on topics to improve their health and safety programs and earn rebates while they're improving health and safety. Through the Health and Safety Excellence Program, businesses can reduce their risk of injury and illness in the workplace, contributing to their bottom line. We've distributed over $102 million in rebates since the creation of the Health and Safety Excellence Program in 2019. By many measures, the Health and Safety Excellence Program has been a success. And we know it's making a difference to workplace health and safety. We have the evidence, which our featured speaker, Dr. Chris McLeod, is going to be speaking about in just a minute. We've also received a lot of positive feedback about the program. And in our current period of economic uncertainty, the rebates matter to businesses, particularly small businesses. And most importantly, more than 1.2 million Ontarians are safer because they're working at a business that is enrolled in the Health and Safety Excellence Program. But we know we can do more. We designed flexibility and adaptability, that's a tough one, into the program from the start. And we've asked businesses along the way how we can improve. So we've listened and learned on this journey. One thing we've heard loud and clear is that one size does not fit all. What works for a large business may not work for a small business. So the program has to be scalable, and that's one of the findings from the study on the effectiveness of the Health and Safety Excellence Program that Dr. Chris McLeod, who is the Associate Professor and Director of the Partnership for Work Health and Safety at the University of British Columbia, is going to be talking to you about. As one of the recognized leading Canadian institutions in health and safety research, UBC was a natural choice for a partnership and has given us an unbiased study of the program. For over 5 years, I've now been hanging out with Dr. Chris McLeod, and his team has done some exceptional research to be able to come up and speak to the impact that the Health and Safety Excellence Program is having. I'm now going to hand it over to Dr. Chris McLeod to give an overview of the study, and then I'm going to introduce our panelists, and we'll get into more detail around what we found in this study. Please welcome Dr. Chris McLeod.
Good morning, everyone. It's a real pleasure to be here from Vancouver. I just want to. It's always special for me to come to Ontario. I started my research career 25 years ago at the Institute for Work and Health, and I really value the investment that Ontario has put into research, particularly in health and safety, as well as the opportunity to work with a wide variety of prevention and system partners, certainly the WSIB, but some of the health and safety associations that are in the room. So today I'm here to talk to you about the research that Rod introduced, where my research team, the Partnership for Work Health and Safety at UBC, embarked on a 5-year study of the effectiveness of the Health and Safety Excellence Program. And the structure of my talk today will really be to talk about what we learned in terms of how the program worked and why it made a difference, as well as identifying how research could inform some insights that helped improve and made the program more relevant to a broader range of businesses in Ontario. Before I begin, I just do want to talk a little bit about the Partnership for Work Health and Safety. Here is a picture of the University of British Columbia, where we have the distinct fortune and privilege to work on the unceded and ancestral territory of the Musqueam people. The Partnership for Work Health and Safety is a research unit within the School of Population and Public Health at UBC. And we have been working with compensation and prevention partners nationally for about 20 years in conducting policy relevant and evaluation research. And certainly in Ontario, but also in BC, where our main partner is the WorkSafe BC, the compensation board in British Columbia, but we have certainly worked across the nation and particularly also in Ontario. So Rod talked at a high level about the Health and Safety Excellence Program. I suspect many people in the room are familiar with the program, but for those that are not familiar with the program, I'll just underscore a few key features of it. It is designed to be very flexible in terms of identifying and supporting businesses in terms of a health and safety journey, with the intent that by the completion of that journey, they would have an effective and functioning occupational health and safety management system. There are a variety of different topics. As of October, you can see that there's somewhere in the neighborhood of just under 40, or I think 37 topics that are identified as foundational. So if businesses come to the program and they're at an entry level in terms of their safety practices and their management systems, there's a variety of foundational topics. But businesses can enter at a higher level and they can progress. And so this is a distinct feature of the excellence program compared to some of the other audit-based programs that are quite common out there, not only in Ontario, but across the country, such as CORE, ISO 45001, and SOCI. So we were approached by the WSIB in fall of 2019 while they were about to implement the Health and Safety Excellence Program, in terms of having a conversation about how we can help evaluate this. So one of the unique things about this particular research program is that we started evaluating it at its gestation, at its genesis rather, in terms of when it was first rolled out. And so our evaluation was iterative and summative across five years. And that value of the research partnership, particularly when we're talking about something where we are evaluating the program as it unfolds, did I think a couple of really interesting and unique things that we don't often see with academic evaluations, is because it actually meant that the insights and what we were assessing or understanding or investigating each year were provided to the WSIB. And as they unrolled what was a new program, and through its maturity over 5 years, they were able to integrate the insights from the evaluation into the program. And I think that's a really important point to make, particularly in the context of the theme of this conference, where we are talking about how research and evidence can improve and infect health and safety programming. So that idea of having that type of partnership and thinking about how we flow information to the decision makers, the policy makers, those that are implementing the program, I think is really important. And you'll see that throughout the presentation in terms of how our findings changed and improved the program, as well as identifying the key features of it where it was successful. So this is what we did, and I'm not going to go into the methods of the research in any great detail today, but just to underscore that we were doing an evaluation that took place over the span of the entire 5 years. We started with talking to businesses who enrolled and participated in the Excellence Program in the first 2 years of it rolling out, so that was 2020 and 2021. Then we did a deep dive into document analysis to understand how the validation and assessment process worked. And then finally, we did a robust quantitative analysis of the impact of participation in the program on work injury rates, specifically lost time injury rates and serious injury rates or high impact injury rates in the province for participating firms. So I'm going to highlight a few things that we learned, first from what we learned in terms of talking to and interviewing the participants in the first 2 years of the program, and what they experienced and why, in terms of our findings, we did find that the program did make a difference. And then we'll focus on some of the things that we learned that were implemented in terms of the current program that you see today. So one of the things that we did find is that participation in the Excellence Program led to a greater commitment to safety, and particularly more engaged leadership. So leaders were more involved in health and safety. There was a greater prioritization after seeing the benefit of going through the program, and that the incentives that Rod did talk about were key in terms of ongoing support. Here's just a quote. We've got a number of quotes. I won't necessarily read them out. And I'm fortunate that I can actually read it still from this distance. But I had lunch today, and with the 3 owners, we talked about my focus areas for the next year. And instead of me suggesting health and safety excellence, they did. They said, we want to continue with the program. We see the benefit. We want all of our policies and topics to be this robust. So just an example of one of our participants really saying that the program resonated with leadership, and we saw an increased commitment to health and safety as a consequence of the program. Similarly, we saw and we heard that had an impact on the shop floor in terms of employee behavior. So there was greater employee buy-in, so greater awareness amongst employees of the program, but also health and safety, more conversations, so people talking about safety, and greater employee participation in health and safety decisions. In this case, quote, they're feeling more open now to email and call. I get calls after work. I'll get emails, which I wouldn't probably get before. So the participation in the first 2 years of the program led to greater conversation, awareness, and integration of employee perspectives into health and safety amongst participating businesses. The format and structure of the program, so both the fact that businesses were able to identify specific topics that worked for them with input from providers, but also the structure of what they needed to do in terms of identifying or completing certain aspects for topic completion. That step-by-step progression was viewed as positive and facilitated by many participants, and that in some cases, in a lot of instances, that was very achievable in terms of the incremental stepwise fashion of the program. So that's it. It's excellent because it's not just one time and then you kind of forget about health and safety. Here you build the whole, from the foundation, the medium, and then there's all the different stages in the program. You see how the safety improves. Also, the information provided by the Excellence Program, the program providers, the support from the WSIB was seen as trusted by participants. So a trusted centralized source of guidance, the ability that they didn't have to go and look for that information elsewhere, but it was available through the supports provided via the Excellence Program, as well as, in many cases, the support, whether that was via providers or the WSIB, to apply it in practice. I'm just going to skip this quote. I'll just give you a second to read it. And I'll move to one of the final things that we found, which I think is really important in terms of going through a program where you move from an approach to safety that might be viewed as ad hoc or reactive to thinking about how you can be proactive. So this aspect, I think, is really fundamental to what we need to see or want to see overall in terms of safety system performance. So we move to proactive. We're anticipating what's going to happen, what we need in terms of safety and prevention, and we saw that participants did see the Health and Safety Excellence Program providing that pathway for many of our participants. Because it provided that guidance, right? So without that, you're just going based on, okay, well, if I get a ministry inspection, they'll tell me what I'm doing wrong or not. Whereas we are a lot more proactive. So senior leadership in a large construction business. So we also looked at it quantitatively. This was after 5 years. So taking those firms that entered the Excellence Program in 2020 and 2021 and looking at their safety performance over 5 years, comparing them to firms who were similar but did not enter the program. We do have papers that go through the detailed research methodology of both the interviews as well as these statistics, but you can see that for those first 2 years, participating, looking 2, 3, 4 years out, we saw meaningful differences, so meaningful changes in lost time injury rates for a number of participants. So for newer registrants, so that would be those that entered in the second year, in manufacturing in particular, where we saw the largest impact of almost 20%, also amongst large businesses, and for those that completed one or more action plans. So those individuals that progressed through the program or businesses that progressed through the program, we did see a greater safety effect in terms of lost time injury. This is just a lost time injury. We found similar trends, although not always in the same sectors, for the high impact. So those are claims or injuries that have a much greater burden, both in terms of cost and disability in the system. There were some areas or some sectors where we didn't see large improvements, particularly in lost time. So in the healthcare sector, amongst very small firms, and in construction. This, I think, is an area for future learning in terms of how do you adapt a program and make it useful and salient and relevant across multiple sectors, and we'll get to those learnings in a moment. But I think the key take-home message is, in the context of rolling out a new program and being able to follow it and evaluate it over a 5-year period, we did see emerging evidence of a safety effect in lost time injuries, as well as, in some cases, high impact injuries. So this, I think, again, is a participant, so these are real people talking about the program at its best. And this is a participant, an HR director in a medium manufacturing business, saying, because it works, I mean, it has value. You can see your health and safety program come to life. You learn about it, you learn how to do things well, you have a better relationship with your safety consultant, and it's an infrastructure, a way of motivating people to keep health and safety in the forefront of organizations' priorities. So, a really nice illustration of an impact that this program had on a particular business. One of the things that we also did is we learned and identified areas where the program could be improved or targeted. Rod talked a little bit about some of those insights already in terms of the issue around being more flexible, in terms of health and safety program not being a one-size-fits-all, and the various different types of supports that different businesses might need in order to more effectively and uniformly progress through the excellence program. So we'll talk a little bit about that right now. So opportunities to better support business. So that idea that the one-size-fits-all didn't always reflect size, sector, or maturity, so that we did see or find different perceptions of the program when we were looking at small businesses versus very large mature businesses. In some cases, small businesses identified that they needed more support in order to progress, and that they were challenged in terms of having lack of internal resources, whereas very large businesses were able to progress or started a much later point in the excellence journey, and then needed or were looking for guidance in terms of what they would do after completing that journey. We identified opportunities to improve the internal validation. We identified opportunities around more consistency around provider support and the type of information that providers gave and how they actually supported firms in terms of choosing topics. So you can see this quote. It's very administrative, and you know retail is not administrative. We don't have office people in stores, so it's just we have to be very creative when we send it out to stores and how they can implement, making it very simple for them. So that's just, you know, a really kind of common sense example about how in some businesses they don't have the administrative capacity to do these types of things. That's not a surprise to, I think, anyone in this room that creates and supports businesses. So how do we support that? How do we provide them with that administrative capacity so that they can develop those systems and they don't feel as if going through another audit or management system or assessment becomes overwhelming for them? In this case, just improving some of the topics and tools. So in some cases, we identified opportunities for simplification of topics or providing clearer feedback. I'll just read this quote here. At the beginning, they were like, oh, you need a page, like a written page of the story of what you did. It shouldn't be too much work, and it's like a couple of pieces of evidence showing what you completed, and that there's no criteria for something that needs to be done. So the important point here is, while we found clear evidence of effectiveness, we also found opportunities for improvement. And so my next slide really illustrates the value of this type of research partnership, where we identified and heard certain things over the course of our evaluation that we provided back to the WSIB, to Rod and his team, and they made changes. So in terms of that fit and accessibility, how do you adapt the program? And some of the things that were changed is different and more clear pathways for small businesses and those with core. Clearer pathway from the health and safety excellence to SOCI. Larger foundational topics broken into smaller, more manageable topics, so that's more addressable to firms that may not have as many resources. In terms of clarity of expectations, clearer guidance on topics, including templates, examples, and refreshed instructions, information on how to improve the validation process, information that helped improve the portal access, so how do people actually navigate this, again, from an administrative point of view, and then recommendations and changes related to the relationship and the role of the program provider. And that's thinking about single validator per employee, but also more quality assurance around the program provider and supporting that delivery model to a greater extent. So what can we say about what we learned? we can certainly say that we saw clear evidence of effectiveness for this program, but this is only one of many programs, not only in Ontario, but across the country. And so, this adds to a growing body of literature and research that clearly demonstrates that health and safety programs can and do improve health and safety and improve and reduce worker injury. So these are programs, if delivered well, that do work. And I think that's a very important insight for all of us to understand that are in the health and safety domain, because we do a lot of things that we actually don't know that work. So we try a lot of things and we hope they work, but we actually do, in terms of effective delivery and progression through health and safety programs, have identified a broad area that I believe is actually quite effective in improving health and safety and reducing work injury on the shop floor. There is more work to do. Things that are important are focusing on relevant program content, ongoing rigorous assessment, and effective support for businesses from providers, and also that idea of moving beyond one size fits all. And I think ultimately what we do want to see once these programs have been implemented is the sustainability of these programs. So people go through a program like the Excellence Program, but how can we ensure that that journey leads to something that is sustainable, so that when they're perhaps navigating the health and safety challenges that they face as businesses, perhaps not being in the program or moving on to different areas, that's embedded in their program, that it is embedded in their business, and it is sustainable and durable. So what did we learn from the partnership, the research partnership? I think the real value here is we started the evaluation early, not after the fact, and so the insights from the evaluation were almost provided in real time, or as close to real time as we could, to the WSIB, so that they could understand how the program worked and whether or not changes were needed. Focusing on the implementation, a lot of the first 3 years of our research was very much focused on implementation. There was a lot of excitement and like, when are we going to know this works? Like, when do we know that this is actually going to have an impact on injury rates? And one of the things I kept saying is that we need to let things happen. People need to go through the program. They need to adopt the practices. We can't just give you that answer immediately. And to the WSIB's great credit, they were patient. I've worked with decision makers for a very long period of time, and I can say one thing is decision makers often are not patient, and in this case they were willing to wait for those results. And I think that was very important, because if we hadn't, we wouldn't have been able to really give a clear signal on the fact that we saw effectiveness in terms of injury rate reduction. I'll just move to where we're going next, and I think we'll talk a little bit more about this on the panel, so I won't spend too long on it, but we are continuing working with system partners in Ontario, the WSPS, as well as the WSIB, in terms of evaluating not only the Excellence Program, but a broader suite of health and safety programs in terms of better understanding and providing information that what works and how we can make workplaces in Ontario safer. I'll just note that we do have 2 peer-reviewed papers based on this evaluation. They are open access, and I think the conference providers our conference organizers are going to find a way to share that information if that's what you're interested in. So with that, thank you very much for your attention. I'll turn it back over to you, Rod.
Thanks very much, Chris, and thanks for calling me patient as well. I appreciate that. Okay, I want to introduce the panel. Of course, you've already been introduced to Dr. Chris McLeod. We also have Sobi Raghunathan, who will be joining us. If you can come up, please, Sobi. And you've already been introduced to Sobi, so I won't take time in going over all of the amazing things Sobi is a part of, but I wanted to introduce 2 other speakers as well, or panelists. Jody Young. Jody Young, if you can come up and join us. Jody it has a lot of senior executive experience coming from the Ministry of Labor, Immigration, Training and Skills Development, and is currently the president and CEO of WSPS, Workplace Safety Prevention Services, and has been a great supporter of the Health and Safety Excellence Programming, having the largest membership within the Health and Safety Excellence Program. And I also want to introduce Carrie Briley. Carrie Briley is a part of my team at WSIB. She has a lot of executive leadership experience across various roles at the WSIB and has been instrumental in the ongoing development of the Health and Safety Excellence Program. So thank you to all the panelists for joining. What we want to cover in our discussion this morning is really looking at how evidence has informed the actions that we've taken over a number of years that we've been working with Chris McLeod. To start off, I want to direct my first question to Chris and continue on the dialogue from his presentation, and I'll ask Carrie as well to see if she has any comments on this. But Chris, what would you say is the kind of the critical factors that have led to the effectiveness of the Health and Safety Excellence Program?
Yeah, thanks for the question, Rod. I think I'll just touch on three things. First of all, I think there is that underlying commitment. So the decision to sign up, embark on that journey, and undertake topics is a real sort of indicator of a commitment. And so that commitment, I think, is a real signal, and I think part of the effectiveness we saw, goes back to that commitment. But then secondly, there is the progression. So we did see firms that, progress through topics. That's where we saw a more durable safety effect, so completing the topics. And then I also think the other thing that's important here is the relevance of the topics. Now, we didn't specifically look at that in the research, so I'm sort of inferring from a broader research, but taking the right topics for that particular firm or individual, I think, is one of the three things. So commitment, progression, and relevance would be the three things that I would tap into in terms of explaining the effectiveness.
Yeah, thanks, Chris. That's definitely clear. And it would be great if we knew and would be able to tell the audience, take these 6 topics and perhaps more to come on that. Carrie, do you have anything to add?
Yeah, I would say definitely what jumped, lots of great learnings from this research, but one of the things that definitely jumped out at me from the program design perspective was the progression. Knowing that businesses that are progressing longer in the program and are integrating the learnings in their day-to-day operations will see better outcomes. Really led me to hone in on, well, how can we reduce the friction, reduce those barriers that would cause a business maybe to not progress. And so doing things like making our digital services and the online tools easier to use. And even things like meeting the unique needs of our customers. So that really stood out at me as well. So as great as the research has told us this program's working, and that's wonderful, honing in on the pieces that maybe we're not seeing that impact, such as Dr. McLeod talked about mental in the healthcare space. And so one of the things we did while the research was still continuing was develop 2 new topics within the program to help businesses build a psychological health and safety program, just knowing that that is going to meet the unique needs that perhaps the topics related to physical safety weren't necessarily meeting.
Great, thanks, Gary. So again, kind of tapping into the flexibility and adaptability of the program. My next question is for Sobi and Jody, and I'll start with you, Sobi. So we know the program is having an impact, but beyond outcomes with respect to injuries, what have you seen with respect to employers who are in the program and the capabilities that they're building to create a better safety culture?
No, thank you, Rod. What I see is improves the safety culture. We always tell our clients it's about bringing you into compliance. So basic compliance is what the Occupational Health and Safety Act requires you to do, but going beyond that is participating in programs like the Excellence Program. If they don't need to go for core or ISO to start with, but they can get started with the Excellence Program, try to build small bite sizes of 5 topics at a time where they're building their safety management system. Core ISO is like a huge undertaking where they need to focus on 20, 25 topics, which they need to implement within a short period of time. It may take them about a year to 2 years to get them certified, and it's quite a bit of commitment. Whereas with the Health and Safety Excellence Program, it could be any industry, but they need to start somewhere with the structure and with the process. And they could pick the foundational topics to implement those in small bite sizes, which is going to help them put the basic platform moving away from just basic compliance into the next level of excellence before you go into full management system and becoming socio-accredited. It's like those bite sizes, which is going to help them build their safety culture. So they're continuously doing and improving on a topic and then moving to the next topic. And they don't need too much of investment, and the way the program is structured is great. It gives them some incentive for them to focus, but it also gives them enough support, and it's specific to the organization. Again, it's not one size that fits all, and with all the validation and processes that goes through, it have to be specific for the organization, specific for what they are dealing with for those particular topic.
Yeah, thanks, Sobi. Just to follow up before I go to Jody, you have a really large membership in the Health and Safety Excellence Program. Based on your comments, do you find the program is well designed for small businesses?
Definitely. As a management system consultants, we are not just trainers and software people. We are actually safety consultants. We help companies, bring them into basic compliance. If you look at our journey map outside, it talks about basic compliance and then moving to excellence and moving to management systems. The program is well structured, especially for small businesses. One of the things, Buy Ontario initiatives. If they are not mandating for core or ISO, we should be actually putting and working with buyers of services or the larger employers to make sure the smaller businesses are participating in programs like the Safety Excellence, which is going to help them build the program and start building small bite sizes, but it's going to take them through that journey for excellence.
Thanks, Sobi. Jody, if you can speak to your experience.
Yeah, I think the only thing I would have to add that Sobi hasn't already covered is around one of the obvious, and that is for businesses to be ready for the arrival of an inspector, for example. It's an excellent way for small businesses to set up a framework for due diligence within their workplaces and be able to demonstrate that with a systemized approach, the rigor in place that is suitable for one that the regulator would expect as a small business that's operating within the province. And I think the other thing that I was thinking about from this morning's presentations is around preparing them and their ability to bid for jobs, and having that record in behind them of a safety program that is relevant for the size of the business that they are.
Thanks, Jody. My next question is for you, Carrie. Carrie's been instrumental in the design of this program, and I think one of the things, and Dr. McLeod spoke about this, that's unique, is that we worked with UBC from the beginning, from the launch of the program. So a key strength is that the evaluation findings year over year shaped the changes in the program. Carrie, can you speak to a couple of specific changes that you would point to of how this ongoing research has helped us land the program where it is today?
Yeah, sure, Rod. And I think it's important to say that the research and design relationship is so important because it really allows us to bake in a learner-centric design principles when we're looking at making changes to the program. And one of the most important things is, for me, I like to find problems. So I like to see the research and tell me all the good things, but tell me the problems, because that's where the magic is for me. That's where I know the opportunities are and where we can make things even better. And but the tricky part is you have to make sure that you don't break what is working while you're trying to fix what isn't. And so it's really invaluable to have real-time insights to take into the design, because you can make sure that you're plugging some holes and shoring things up and reducing that burden and making things simpler and better without really impacting in a negative way those things that are really helpful and working within the program. A couple of examples. Well, firstly, I think this research helped us to hone in on our target customer for the Health and Safety Excellence Program, because 97% of WSIB customers have less than 100 employees. So when you think about over 300,000 businesses, and this program can meet the needs of all businesses, but particularly those that are small or new to health and safety, really allowed us to focus our changes to support that customer base. And then a couple of the things that we did for small businesses, based on the insights from Dr. McLeod's research, is we designed a recommended pathway. So smaller businesses were telling us, love this program, but it's a little overwhelming because there's so many choices, there's so much flexibility. And so just tell me what to do, or tell me how to get started, and hold my hand a little bit more as I go through this journey. And so we designed a recommended pathway that will help smaller businesses, or again, those medium-sized businesses new to health and safety, get started on their journey and progress through the program. We streamlined validation and the evidence submission, so the things that the businesses have to send to us in order to get their rebate, we really streamlined that and simplified it to make it easier and make those rebate payments quicker, because ultimately that money's reinvested into health and safety, so that's a very important piece of the program. And then thirdly, on the topic of incentives and rebates, we knew incentives were working really well, but we did hear that there's some complexity or some lack of understanding around how much rebate that they would receive and the amount of work it would take to get there. And so we really redesigned our rebate structure to simplify it so anyone can understand their investment in health and safety and what the financial incentive will be at the end.
Great. Thanks, Carrie. And I'll say that there's real evidence behind these changes as well. Like our journey from a customer satisfaction perspective, the year after we launched the program, we had 77% customer satisfaction. 5 years later, using this evidence, last year we had 86% customer satisfaction with the program. My next question is for you, Jody. The study talked about different motivators on why employers join the program. From your perspective, what are the strongest reasons that organizations choose to participate in the Health and Safety Excellence Program?
So the term I like to use is business case for safety, and the HSEP program is a classic example. The evidence is absolutely clear. Businesses that invest in safety early have experienced fewer disruptions, they retain their talent, they create a better culture, and the return on investment economically is there. I think a couple of other things that jump out for me, obviously the financial incentives that Carrie was just referring to are often the driver for why small business come to the table to work with us in the first place. They may be looking for ensuring their regulatory compliance or understanding their responsibilities and making sure that that's covered. It may be, as I referenced earlier, about bidding on jobs with municipal contracts or other large organizations. And I think for us, what we've found is once, they're in, building that really strong relationship with the HSEP provider, keeping them engaged in that cyclical approach that's established by the program, and they start to see the momentum. With that momentum brings, again, that return on investment. And so I think those are some of the key drivers that we have experienced in our HSEP journey.
Great, thanks, Jody. My next question is for Sobi and Jody. And I'll say that when we designed the Health and Safety Excellence Program, we made a specific and clear decision not to become another standard. But there are many. There's CORE, there's ISO, there's SOS. From your perspective, and I'll start with you, Sobi, where do you see the Health and Safety Excellence Program fitting in that landscape, and perhaps what's unique about the Health and Safety Excellence Program in the context of small and growing businesses?
So what we typically tell all of our clients, and we have clients from various different sectors, so from hotels, motels, restaurant, to manufacturing, to construction, infrastructure, to healthcare, and municipalities. And what we typically tell them is, if you don't need to go for CORE or ISO, start with safety excellence. So it's a very structured program. You could build bite sizes of 5 topics at a time. It typically takes them about 9 to 10 months to complete 5 topics successfully, and then build another 5 topics. So we have many clients. I mean, we have taken over, I would say, 700 to 800 clients, or I think close to 1,000 clients in the last few years from various different sectors, and they are in their multiple cycles. So they have finished their, first, second, third, now fourth, fifth cycle. And some of them are on their 5th and 6th cycle looking at going, okay, what's next? And this is where SOCI will fit in beautifully for them. They don't need to go for CORE or ISO, but now they can see how they can become safest employers in Ontario and try to reach for that goal without having to go for an identified safety system. So there are many different ways, and it's a great way for especially small to medium-sized businesses to get started. Even larger firms, we have some really large firms with over 1,000, 2,000 employees. They're on their 4th cycle, and they haven't gone for CORE or ISO, but now they're actually building or perfecting their program. They have programs, but they're perfecting their programs and making continuous improvement while they're tapping into actual rebates, and which is a good incentive for them to reinvest in the program. So definitely it helps them keep the culture going.
Jody, do you have anything to add?
Yeah, I don't have a lot to add, but just to reiterate that, HSEP is designed to complement the programs and not to compete with them, and I think for all the reasons that Sophie's just described. We'll move to the next.
Okay, the final question, and I'm definitely directing this to Dr. McLeod, but anyone else who wants to comment on it as well. To kind of wrap things up here, so there's been some great findings on the Health and Safety Excellence Program, and as you mentioned, Dr. McLeod, there's many programs that organizations can choose to enroll in. What's been fascinating about this particular study is it's been followed for 5 years. It's now clear evidence that it's having an impact, and we've also learned a lot from a program design perspective. So my question is, what's next? We still aren't where we want to be with outcomes in Ontario. We know that there's still a lot of work to do to protect people when they're going to work. What would be your advice in terms of the next areas of kind of research and perhaps how it relates to the evolution of this program?
Yeah, thanks for that. In thinking about what's next, so we look at programs like the Health and Safety Excellence Program and other programs which we know make a difference. how many firms, ultimately go through that journey? It's like 5, 6, 10. We scale it up. We think about all of the health and safety management programs that are in Ontario. It's still a very small proportion of all businesses. And so I think one of the key things that we need to do is think about how do we take what we've learned in these programs, the Excellence Program, CORE, SOC, the other programs, and help that much broader swath of businesses who may in fact be the ones where we need the most intervention, so that we see a broader systemic effect. So and that I think is, in terms of the work that we're doing collectively with the WSIB, WSPSS, in terms of that focus on ongoing research and evaluation of not just the Excellence Program, but other types of services that are provided to small firms, is that there is a real opportunity there to learn what works. You and I have had the conversation many times over the years about just how challenging it is to crack the safety nut for small firms. Most employers are small firms. Not most workers don't work for small firms, but most employers are small firms. And that is a challenge. So it's not just specific to Ontario. The conversations that I have with people across the country are, how do we really move the dial in terms of those smaller businesses? In Ontario, that's businesses under 50. The threshold might be different across different provinces. And one of the exciting things is, and one of the reasons why I'm here and engaging and talking to you today is that we're doing something on that in Ontario. And I'm hoping that over the next couple of years, as we continue to do the research, there will be real actionable insights that we can say did make a difference and expanded the reach, particularly in small businesses.
Thanks, Dr. McLeod. And maybe last word I'm going to give to Jody, because I'm being given the signal here. But
I know, I'm getting the signal too
go ahead,
from Ron.
Go ahead.
So really quickly, meeting businesses where they are is my absolute mantra. And focusing on leadership and focusing on our leaders of tomorrow. How do we appeal to the younger generations of leaders? How do we make our safety messages resonate with them? And lastly, as we're working with, as HSEP providers, working with small businesses, how do we ensure that we encourage them to really dive into those topics that they may be harder to tackle, they may be harder to deal with, encouraging them, hand-holding them along so that we can truly actually get them to a place where they're dealing with the things that are driving their injury and illness rates to the greatest degree. That's it.
Great closing, Jody. Thank you, Dr. McLeod, Sobi, Jody, and Carrie for joining on the panel. Thanks, everyone.